Hi, I'm Art Caplan at the Division of Medical Ethics at the NYU School of Medicine. I had a horrific, terrifying, disturbing phone call some months ago. I got a call from a surgeon who had been asked a question about the use of data from unethical sources. Many, many years ago, during World War II, an anatomist named Pankovs did work on bodies sent to him from concentration camps and came up with what is one of the amazing medical wonders of the world, the Pankovs Anatomical Atlas. People today still agree that it is a unique resource. It is astounding in terms of its accuracy and detail. I don't think anything has ever been able to rival this book. However, it is built directly on the bodies of victims of Nazi terror and murder. So the question comes up, what to do with the Pankovs Atlas? And the question that I was asked, there was a surgeon in the middle of an operation on the leg of a patient. Apparently she could not find a particular nerve that she wanted to move or handle in some way, I'm not sure how, but she said the only place to really get the detail she was looking for was by accessing the Pankovs Atlas. She'd seen it in medical school and she knew that it would help her if she looked at this particular volume to get some guidance. It also was the case that she felt that if she didn't do this operation, this delicate operation properly, the patient would lose their leg. So there was a lot of quick phoning around to say, can you use information that was immorally acquired in order to try and benefit a patient? And I've thought about this issue over the years. It comes up with the use of data from concentration camp experiments, the Tuskegee study on African American men in the South, which guided much of our understanding of syphilis. And there are many, many other instances where immoral experiments produce data of value. But in this case, you're going back and sort of accessing immediately this atlas in a very real way, and you may want to later explain yourself to your peers or to a patient or the patient's family. A very tough call. My argument is, yes, you can use the atlas if the stakes are high, saving a life, saving a limb. If you have a very important goal in terms of benefiting an individual patient or group of patients, and if there's no other source or resource to go to get the information you need, and you also acknowledge in any writing or papers about this that you use something that was immorally generated, in this case the atlas, and that you don't credit Pankovs or any of his associates for the atlas. You just say, I had to look at this atlas built on concentration camp victims from 1946, I think, was the latest of the publications. And you don't give credit or reward to anyone associated with the generation of the book. At the end of the day, I would not want to see lives lost or people severely disabled because of fear of, if you will, justifying immorality. So we have to be very careful about what is done and how it's reported and how it's presented when we do it. But I think the goal of saving life, preventing disability, justifies even using some of the most horrifically generated information that has ever been obtained by medical science. I'm Art Caplan at the Division of Medical Ethics at NYU School of Medicine. Thanks for watching.